Hello everyone, welcome to the lesson 12 of the Health and Wellness for Older Adults course. Let me just see something. Yep, this thing definitely doesn't want to work. Anyway, this chapter is going to be all about prevention and health promotion. Okay. So prevention refers to any kind of activity that's going to reduce the incidence and severity of disease, disability, and premature death, or the probability of, the incidence, yeah. So there are three different types of prevention. We got primary prevention, secondary prevention, and then tertiary prevention. So primary prevention, this is all about practicing habits or doing things that will help you prevent disease or anything like that from even happening, okay? To just keep illness completely away from you. So some different things that you can do, okay, or that would count as primary prevention. So let's look at some examples. I'm sorry, I can't write all this down, so just please pay attention. So some examples of primary prevention could be stopping smoking, okay, so smoking cessation, so that you don't have any sort of adverse effects from smoking. Also, some examples could be washing your hands, making sure you're not spreading any germs. Also getting vaccinated, okay, getting vaccinated against maybe the flu, okay, so you do that so that so the flu doesn't even happen to you when flu season hits. And that's one thing that is actually highly recommended for older adults in general, or even just anyone who has a chronic illness or any kind of disease. But anyway, so secondary prevention, the next level of prevention, this is early detection of disease or early treatment of disease. Okay, so this is engaging in health screening to detect disease at an early stage. Okay, this is also treating disease at a very early stage. Okay, when you detect it immediately while it's very small, you treat it right away. So that's secondary prevention. Secondary prevention is tied to a lot of primary health care. Okay, so then we have tertiary prevention. This is where you properly care for an already established disease. You already have a disease, okay? So tertiary prevention is you doing things to prevent this disease from either getting worse or also preventing from any kind of anything that this disease can lead to. Because many diseases that we catch or that we obtain can lead to other diseases or other chronic illnesses. Okay, like let's say, for instance, we already know we have high cholesterol. Okay, well, high cholesterol can lead to a variety of different ailments. Having heart disease, that can cause other problems. Okay, so tertiary prevention is knowing what you already have. Okay, you already have a well-established disease or something like that, and then you're taking measures to make sure nothing else happens. Okay, another example of this could also be if you were bedridden. I give this example a lot. If you were bedridden in the hospital, maybe you just had surgery or something. One thing that they do that would count or would be an example of tertiary prevention would be like if you're bedridden, you tend to bruise. Okay, our skin tends to bruise when it just is like our muscle tissues are just sitting there still. Okay, they're not moving at all, and there's a lot of weight and pressure that is building up right here. So this can get So your skin, you can get blisters, okay? Like on your back and your, all your rear area if you're just laying on your back all day. So what a lot of nurses like to do, or what, they have to do, would be to move you. Okay, so they'll move you to the side and you'll lay like that for a couple hours, and they'll move you to another side and you'll lay like that for a couple hours, and then you'll lay on your back for a while. And just like to move you so that you're not sitting in one spot for so long and getting blisters on your skin. Because if you do that, you're in a hospital already. You are at risk of infection. Okay, if you break the skin, you're definitely at risk for infection. Plus, it hurts. Okay, so that's another thing. That's another example of tertiary prevention. Like, you already have your established ailment, disease, whatever you had, but now you're taking measures to make sure nothing further happens or doesn't develop into another disease, or you don't get infected by something or things like that. Okay, so the Healthy People Initiative. Typically every 10 years, every decade, there is a new Healthy People Initiative, and this is a government-sponsored and monitored program to establish priorities and set goals to improve the United States, the health of the U.S. citizens, right, of Americans. So it started in 1979, and the whole point was, so it's like a primary prevention. Okay, so what are some examples of primary prevention? Vaccines and pills, okay? Again, primary prevention is preventing disease from occurring in the future, okay, taking steps that will prevent disease from happening. So we can have vaccines where we have vaccines. Having a tetanus shot, isn't that something we have to take every 10 years or so? That's one thing, a vaccine that we prevent from, tetanus from happening to us. We take vaccines, or we have the flu vaccine, I know, to prevent influenza. And I know that usually they want to promote this mostly to old people and those who already have diseases, but I think most of us are those who are at least part of like an HMO or something like that are offered the flu vaccine every so often, right? Every year when it comes, then they go, oh, hey, would you like your flu shot? So also taking aspirin every day as a daily regimen, that can also help reduce the risk of heart disease and heart attack, right? So there are many things that we can do to prevent things from even happening. Okay, so secondary prevention, remember, this is getting screened. This is early detection of disease and early treatment of disease. Okay, so screening is targeted to populations that are at risk for certain conditions. So usually those who might be over the age of 50 for certain cancers, or those who might be over a certain age for such and such and whatnot. So screening is done on healthy people to find disease early when it can be treated and dealt with. Okay, screenings will include usually health interviews, family history, height and weight, blood pressure, lab tests, x-rays, MRIs, things like that. Okay, that's usually what they use when they try to perform some sort of diagnostic exam. So some challenges to screening. No screening test is absolutely perfect. Screenings can create false positives and false negative results sometimes, and then screenings can result in unnecessary tests or anxiety. Okay, one issue with our healthcare system is that many times physicians, they can prescribe unnecessary tests. Okay, that you may not actually require, but they will prescribe them anyways, whether they're practicing defensive medicine or maybe they're just trying to make an extra buck. And when that happens, that's wasteful, and they're exploiting the patient, and it's causing the patient a lot of anxiety because you think there could actually be something wrong with you. Okay, so anyways, there are many differences in opinion as to what screening tests are actually recommended. And so of course there's going to be conflicting recommendations and whatnot. Some people say certain things are, you need, certain things you don't. We do have certain standards of quality, however, and usually if you are a physician or a healthcare practitioner that is working with like a managed care organization, there are certain standards of quality and protocol that you do have to abide by. Okay, so that kind of helps do that. Okay, so characteristics of ideal screening tests. So first of all, screening tests should detect illness before signs and symptoms are actually present. The test must be accurate with a minimum of false negatives and positives. Okay, so the test should not have so many, not be known to have so many false negatives and positives. Screening and early detection need to actually improve the health of the individual. Preferably screening people should result in a longer life, as evidenced by well-conducted research. Okay, so relevant screenings for older adults. First of all, we have breast cancer. This is randomized control studies that have shown a reduction in mortality for those who are over 50. Okay, mammograms should be conducted yearly for women who are over 50. Breast examinations should also be conducted. Okay, breast self-examinations. Okay, colorectal cancer. So screenings can find precancerous polyps and cancer at the early stage, right? Fecal occult blood test or digital rectum exam, I know, but it's extremely important, and it should be conducted yearly if you are, well, from 40 to 50, because that is typically when those are like the ages, right, when you are more susceptible. Then after 50, barium and enemas, and then colonoscopy and sigmoidoscopy should be conducted every 3 to 7 years. Okay, so when you're just 40 to 50 years old, you don't necessarily need the colonoscopy or anything like that unless there's actual evidence from your fecal occult blood test or a digital rectal exam that actually, tell you that you do need more screening just to make sure if this is cancer or not. Okay, so prostate cancer. This can be screened with digital rectal exam or prostate-specific antigen blood tests. Okay, screening is kind of controversial. Okay, what's best exactly for the patient? But most people or most physicians will recommend screening after age 50. But they must discuss the pros and cons of this particular screening because it is, it's a digital rectal exam. Okay, so anyway, heart disease. So heart disease could start with lifestyle screening, okay, which means maybe you should check yourself what you normally do. Do you live a sedentary lifestyle? Do you have hypertension? Do you smoke cigarettes? Things like that. If you do or you don't, that's something that you should fix, right? And then there are medical tests that will include an exercise EKG. Those stress tests where they're like running? It's like that. The medical tests are not recommended on a routine basis. So you don't necessarily want to do this all of the time, just when your physician believes it's necessary. So hypertension, lowering blood pressure reduces death rates. Okay, and screen with a blood pressure cuff. This may lead to, or hypertension may need to be screened 1 to 2 years. but with high blood pressure, monitoring is essential. Okay. So high cholesterol can be safely treated, so screening is definitely recommended. Women who are over 45 and men who are over 35 should be screened with blood tests, but every 5 years. Okay, and then lipid levels are less likely to increase after 65. So osteoporosis. Your dual energy X-ray absorptionometry is the most accurate test for osteoporosis. Routine screenings are recommended for women who are over the age of 65, and then men and Black women may not benefit from these screenings. Okay, vision. The use of Snellen eye charts for vision loss is widely recommended. Glaucoma can be screened for, and early treatment may help. Glaucoma can be screened for using these tests, And then large-scale tests are underway to determine if screening and treatment can prevent blindness from glaucoma. Okay, so hearing. Although the routine screenings have not been proven effective, treating hearing impaired adults can improve the quality of their lives. Okay, so counseling and interviews may be the best type of screening. Audiometric testing could be done every 10 years or for those who actually have hearing loss. Okay, then problem drinking. So the risk of alcoholism does decline with age. It has to do with maturity and whatnot. So anyway, screening should include specific questions regarding the quantity, the frequency, and the degree of intoxication. All people who drink should be counseled on the dangers of excessive drinking, of course. Okay, so tertiary prevention. Now we're on to tertiary prevention. So this is going to occur after you've already have the disease. It's already been established. You have a disease, right? I mean, you don't, but hopefully you don't. But hypothetically. Okay, so tertiary prevention attempts to prevent further disability, complications, or death, including testing, treatments, and rehab. So this may include education, giving someone more control over the course of their illness, but it doesn't necessarily have to just be education. It could also be rehab. It could be, like I said, when you can turn your bound patients so that they don't bruise and have those blisters all over them, a variety of different things. So here's some examples. You can teach diabetics to check their blood sugar and manage their illness. You can teach those who have heart failure to weigh themselves and watch their fluid intake. You can help those who have arthritis to do flexibility exercises or like yoga poses and things like that, right? Then you can also encourage proper diet for those who have hypertension or heart disease, and so on and so forth. Okay, so preventative services, utilization, and expenditures. How much is it? So Medicare, private insurances, doctors, and patients, none of these really focus on preventative care, okay? Mostly because, well, we're told to believe it's just easier to say take a pill, but while it is, it's also not as profitable, okay? It's not very profitable, and of course, physicians have to spend, they have to see, especially your primary care physician, they're going to be seeing a lot of patients so that they can make ends meet. They don't have enough time to spend a lot of time with each individual patient because, they need to see more patients so they can get paid, right? So, Originally, Medicare specifically excluded preventative care, but now helps cover many screenings and immunizations and all of that. Change is definitely slow, especially when we're working with government enterprises and whatnot. But most of these private insurances, Medicare, Medicaid, or any kind of program like that, has actually, thanks to the ACA or the Affordable Care Act, they're actually required, okay, to include preventative care. Not only are they required to include preventative care, but they can't charge extra out-of-pocket costs for it, okay? So anyway, Medicare covers some screenings not recommended by USPSTF, but this is some that they highly do recommend, okay? And this is also an organization that is difficult to remember because they have such a long name. So I'm going to go ahead and read it out for you. But I'm gonna have to ask that you guys go ahead and write this down because I can't write it. I'm sorry, my pen is not working. So anyways, the USPSTF is the United States Preventive Services Task Force. So the United States, the U.S. Preventative Services Task Force, okay? All right, health promotion. Talking is more important than testing. Isn't it though, if you think about it? Because if we can talk and we can spread information and we can use that information to prevent disease from happening, then we don't even have to test, or it's even better than testing, okay? Why do we have to go to secondary prevention when we can work on first, or primary, sorry. So anyway, the vast majority of diseases that plague Americans are related to our lifestyles, okay? Health promotion includes activities on an individual, community, legislative, and nationwide basis. It is unknown that what efforts are most effective with which topics and populations. Okay, and health promotion activities should be more of a collaborative effort between the doctor and the patient. Doctor and patient need to have be more of a team, okay? Especially primary care physicians have to be more comprehensivists, actually, so that they can take more of an active role and partner with the patient, okay? And they, that way they can focus on, all these different ways they can promote healthy livings and, preventative health and everything like that. Okay, so changing health behaviors. There are 5 stages in changing health behavior. Okay, first that's pre-contemplation. I'm so sorry. And then contemplation. And then preparation, then action, and maintenance. Okay. Okay, so the pre-contemplation stage. This is the stage which there is no actual intention to change any behavior in the future. So this is just nothing, right? This is the state where you're probably okay. So there are 5 stages of change in behaviors. Okay, the first is pre-contemplation, then contemplation, then preparation, then action, then maintenance. Pre-contemplation, this is the stage where you don't even know that there is anything wrong. You have no intention to change anything. You're not educated in what you should know or anything like that. There's no intention on changing anything in the foreseeable future, right? Then contemplation happens. So this is where you are actually thinking about changing, or you're thinking about the information out there that's been provided to you, and you're trying to think, is this something that could work for me? Should I do this? Is it going to benefit me? Like that. Then 3, that's preparation. So you actually have decided, all right, I'm going to do this. I'm going to do something better for myself. I'm going to change. And you're trying to plan out exactly how that's going to happen. Okay, what steps you're going to take and things like that. You're working it all out. Then action, that's when you do it. Okay. And then maintenance, that's when you try to make it a habit. Okay. Try to keep it going. Hold yourself accountable and responsible for that health, that changing your behavior for your health and whatnot. And that's, you maintaining or creating an actual habit or a lifestyle out of it. Okay. Counselors need to determine where their patients are and tailor the counseling to the correct stage, of wherever they are. Okay. To, further help them in the change in behavioral process. Okay. So this shows the whole cycle, okay, of the change in behavior process. So you can go ahead and feel free to go ahead and look at that on your own. Let's move on. So specific health promotion interventions, smoking cessation. So 20% of all deaths are linked to smoking cigarettes, and 10% of older adults still smoke. Okay, 5 to 10 years after you quit smoking, cancer risk drops. So it's actually worth it, no matter what stage you are, or how old you are, or how long you've been smoking. It's actually worth it to just stop. Okay, it's worth it to quit. Okay. So doctors do need to screen for tobacco use and encourage quitting because it will really help the health of the individual. Okay, and then physical activity counseling. So all age groups should engage in physical activities that are tailored to each person's capabilities, whatever they can actually do. Okay, physician counseling has not been shown to be effective, and that's usually because physician counseling is just a one-time deal, and then you don't even get anything else out of your physician until later on, okay, until your next visit. Usually what is more effective is when the people in the individual's environment, their family, their friends, the people they see every day, those they hang out with, maybe if they're part of like a club or a rec center, or a senior center, or adult daycare, or anything like that, the people around them would be, it would be more effective for those people around them to counsel them with physical activity. Okay, and so dietary counseling. For those with diet-related chronic diseases, intensive behavioral counseling is definitely recommended. Take a dietary history, address potential barriers to change, offer specific guidance, and recommend follow-up. Okay, so if you do have, motor vehicle injury prevention. So fewer older adults drive, and they drive less, okay? But many older adults still drive, and older adults should definitely be cautioned against drunk driving and encouraged to wear seatbelts, and also educated about using medications and driving and how the medications may affect their cognitive abilities, okay? Because many older adults, it's very common for them to get into accidents, fortunately. So fall prevention. Falls are a leading cause of unintentional injury and death among older adults. So providing them education about falling isn't even enough. Instead, we need to encourage exercise, safety behaviors, environmental hazard reduction, and medication review. Next, self-care is any individual effort to maintain or improve wellness. The internet provides a lot of information that can help in self-care, but how do you know what information is good, what information isn't? So if you use websites that have a .org, .edu, .government, you can trust those because it's either an educational website, or it's a nonprofit organization, or it's a government website. Also, there is a lot of information that you can get from AARP, Medline Plus, and those type of websites as well. So changing the laws bring about large-scale health changes in some situations. Okay, seatbelt laws, airbags, anti-lock brakes, clean water, speed limits, and also regulations can help in the type of care we receive. Okay, so changing the laws about large-scale health changes in some situations helps a lot. Okay, so seatbelt laws, airbags, anti-lock brakes, having clean water, speed limits, things like that actually help. These are public policy changes that actually help to promote the health of the public, especially those of older adults. So regulations can help in the type of care that we do receive. Okay, preventative care, also in nursing homes. It helps if the policy and the regulations are being fully utilized, okay, and enacting the change. So that's the end of lesson 12. I hope that you guys learned something from this, and I hope it benefits you. But if you have any questions or anything like that, please let me know. I will see you guys in the next lesson.